Dr. Butler, we have started our live stream, and we're going to turn it over to her at this time to give us an update on mental health during this COVID pandemic. So, Dr. Butler, it is all in your hands. Thank you.
I do not have capabilities to screen share at the moment.
Okay. Yeah, I've turned it on for you. And if push comes to shove, I can just be the Vanna White for you if need be. But
that probably will be the fastest way because it just says host disabled attendee screen sharing.
Okay, because I enabled it, but I
That
guess
probably is one of the controls in the admin.
Yeah, I've actually turned it on, and it's just not turning on.
Yeah.
That's okay.
Oh, there it is.
Okay.
It's
Okay,
working
good.
now.
There you go. All right, great. Go ahead. On to you.
Technology. Good evening, everyone. I'm not going to be here for too long. I think that the last few sessions that we had were very informative. But one of the things, even though we give you information, it's also beneficial for individuals to know how to access services and where they can access services, information as it pertains to being a person of color seeking mental health services. We are aware within the mental health community that services being offered is something that has become more in the forefront, especially with everything that's happening in isolation, with the pandemic, a lot of the civil unrest, and also platforms such as different opportunities for engagement by the use of technology and individuals being able to access mental health services and treatment through those platforms that are used by the therapists, as well as being at their home and doing that, which is something that was not as widespread as it is now. So I wanted to provide you with some resources as to what to look for if you are going into treatment or you have someone that may be interested in treatment or some things that you've noticed. I've received some phone calls, so I thought that this was the best thing to do here moving forward is to explain that process, what that process looks like, and also the variations in practitioners and what they can offer to you all. I pulled up mainly the Black and African American. I know we have some individuals that may not fall under this category, but this is what I pulled up. If there are questions, I'll be more than happy to answer them if you do not fall under this category. But with accessing care, you will notice on the screen, I have NAMI, which is the National Alliance on Mental Health. They have chapters in different cities. You can put in different zip codes so that you can find your local NAMI by state or by zip code, by area. You also have a helpline, and you also have a crisis text line that you can access services if you're in crisis or someone you know is in crisis. And so essentially with being African American and seeking services, some of the things that we have already talked about was some racism, discrimination, inequality. All of those things can affect anyone's mental health. But African Americans experience those things at a disproportionate rate than white adults do. And so according to the Health and Human Services Office for Minority Black Health, Black adults in the U.S. are more likely than white adults to report persistent symptoms of emotional distress, such as sadness, hopelessness, and feelings like everything is an effort. But that is important for us to understand because when you are an African American, Black adults are living below the poverty line that has been identified within research, and we are twice likely to report serious psychological distress. And so one of the unfortunate things is that only 1 in 3 Black or African Americans who need adults who need mental health care receive it. And so we are less likely to receive consistent care that is in accordance with the guidelines that govern mental health. And we're also less likely to be included in the research. And that's important for us to understand because we have in the field evidence-based practices that govern the way that we approach therapy and deliver services. And so if African Americans are not being represented in those research studies, then we are unable to ensure that we are receiving treatment that is culturally appropriate and culturally sound for us. And we are more likely to use emergency rooms and primary care physicians when we're experiencing mental health distress or mental health problems rather than accessing mental health specialists. And so some of the barriers to our care is the socioeconomic disparities. And so that's one of the first things that I want to speak on is because African Americans, we are less likely to have access to healthcare, which means that we may not have the resources and that our condition will worsen and then we'll end up in the ER, or we'll think that there's physiological things that are happening with us and we'll go to our primary care physicians. And that could be because we don't have the resources or the disparities that are present, and also because of the stigma that is present within the African American community. Because within our community, we have that one study showed that 63% of African Americans believe that mental health conditions is a personal sign of weakness. And so in order for us to be able to access care, we have to also be able to destigmatize someone going to get help and someone identifying that they need help and they need someone to talk to and sort through some of the things that they may be experiencing. So that's one of the huge things that we have to do within the community, in the African American community, is normalize someone going and reaching out and saying, I'm not well, and it being okay to not be okay, and not having to handle everything and feeling like you have to be in control of everything, because that's unrealistic. We also have the notion of, oh, I have to be a strong Black woman or different things like that, when those markers are not placed on other racial categories. We should be allowed to be feminine and have where we do not have to be strong, and that it's okay for us to not be okay, and for us to say, you know what, I'm having a difficult time with managing that. So when you go into finding out how to access services, if you have if you're connected with insurance and you have access to your resources, you can call the 1-800 number that is on the back of your insurance card, and you can simply ask for a list of mental health providers that are in your area. That's one way that you can search for a provider. Also, another way that you can search for a provider in your area is going on to Psychology Today. Psychology Today is a website that has private practice practitioners in your area, to where you can see what they specialize in and finding out if they would be a good fit for you. Some of those are self-pay, meaning that they have a fee that you pay out of pocket. And then some have where they accept insurance. So you would just have to see their panel with your insurance company, meaning that if they take your insurance. Or they will have a sliding fee scale where, based on your income, you can access services. However, there are could be some challenges with that, especially if you don't have healthcare. So they have community mental health agencies that are in your area. And one way that you can locate those is just simply doing a Google search and putting in mental health facilities. And what will typically come up is different facilities or agencies that are in your area or in your city. And you can call them to find out what is the process for having an appointment, to have an intake, and to also find out how you can access care. They oftentimes will have a sliding fee scale, but it depends on that particular agency. And so they will go, if they offer a sliding fee scale, they will go based on your income. And that's another way that you can access services. Within the services, I know some individuals may be afraid as to what they can look forward to. But in therapy, finding the person that is a good fit is the way that you can ensure that some of your needs are going to be met. So knowing what questions to ask are important. And so asking the questions of, have you treated other African Americans? That's one way to find out their depth of knowledge and understanding some of the things and some of the challenges that we have culturally when working with a mental health provider, because typically we're trained from a Eurocentric standpoint. And so someone being culturally competent with regards to the issues that affect African Americans is important, so that you can connect with them. Also asking them, have you received training in cultural competence or African American mental health? Typically, every student that is going through a program will have training in cultural competence, but it covers so many different categories of individuals that are culturally diverse. And so it touches on a lot of different areas, but at the same time, it doesn't provide the opportunity for expansive study in one particular area. And so that's the reason why you have the other question of African American mental health, because even though they're exposed to it, it's a course that is seen to help practitioners with being exposed to culturally diverse individuals. And so there are some trainings that are specifically for African Americans. And so that's an important question. And how do you see our cultural backgrounds influencing our communication? Each individual that is in a culturally different category than ours has a different communication style. So Native Americans, Caucasians, Asian Americans, all communicate in different ways than one another. And so our practitioners understanding the ways that we communicate, whether it be through verbal, nonverbal communication, is very important. So those are some questions that we can ask so that you can feel comfortable with trying to figure out if your needs are going to be met and if that practitioner is going to be a good fit for us. Also, some individuals will seek help from their primary care doctor or their mental health professional. And so some questions you may want to ask yourself is, did my provider communicate effectively with me? Sometimes we see practitioners or individuals that have education higher than ours or in a different category may not feel that they have the right or feel comfortable with challenging, but you do have the right to have your questions to be asked and to be heard. And so asking yourself, did my provider communicate effectively with me? And if you answer no, then that practitioner has the obligation to clarify whatever it is that you're asking clarification for, or for your concerns to be heard. Also, is my provider willing to integrate my belief, practices, identity, and cultural background into my treatment plan? And that's important because it's not based on their views, but it's based on the way that we see and navigate the world. Because if they are not asking us what we need, then our treatment is going to be is not going to be as effective as it could be. And then we may drop out of treatment. And that's one of the things with African Americans, is that sometimes we will drop out of treatment prematurely. And so trying to make sure that we get the care that we need and that it's culturally sound is important. Also being treated with dignity and respect. And also understanding how the practitioner relates to us, which is important, because when you're in therapy, you're disclosing things that you may not have disclosed or communicated or shared with anyone else. And so you want to feel heard, you want to be respected, and you also want somebody that's going to relate to you well. Those are some things that when you're finding a practitioner that are going to be important. And it's important to ask those questions up front so that you can know if that person is going to be a good fit with you. And there are times when that person is not going to be a great fit. And it's okay to ask them for referrals to another practitioner, or to ask for them to, or give them feedback as to what can be improved within your therapeutic relationship or your communication. When we go into mental health facilities, or when you're looking for a practitioner, you will see some individuals that are licensed clinical social workers, some individuals that are marriage and family therapists, some individuals that are psychologists. And so there are different practitioners that serve different purposes. All can provide therapy, but it just depends on what your need is. So psychologists are heavier in testing. So let's say you have a child that they're having some difficulty in school. They can still provide therapy, but one of the strengths that they have is like an assessment or testing. If there's something that's happening that you may not be able to identify, they can help you with a battery of tests so that they can help you identify underlying conditions or things that may be there. Licensed mental health counselors are stronger with the approach of wellness and counseling. And so they are more trained, they're more effectively trained with the process of counseling, delivery of counseling services, and things of that nature. Licensed marriage and family therapists, they will focus primarily on couples and family work, but they can also provide therapy as well. And then you have licensed clinical social workers who can also provide therapy, but one of their focal points is on systems and connecting individuals with resources. So those are just some basic things and changes if you're trying to figure out, well, what's the differences between individuals providing counseling, and is one better than the other? But it just depends on fit. And then you have psychiatrists who are individuals that will prescribe medications. This website, and the administrators are going to share this with you. It has information and resources that talk about Black Emotional and Mental Health Collective. Then they have all of these other resources that you can go on and connect to, that will have toolkits, that will have webinars, that will have magazines, different things of that nature, so that you can read it, especially during these times. Also, another resource, and even though it's titled for females, there are therapists that you can find on there, but it's just a host that promotes African American women, which is therapy for Black girls. But they have a directory on there of therapists that you can reach out to. And if you're seeking a male therapist, typically the therapists on there will have resources or referrals that they can refer you out if you're seeking a male therapist. Usually they will have, because therapists are usually connected with other therapists in their network group. And then you also have therapy for, I believe it's Black women or Black females. That is another resource, and it has a directory for individuals that are seeking a therapist as well. It's Black female therapists. So that's another resource that can be used. They have a directory as well. They have a website that's typically for males. I could not find it, so I will provide that to the admins when I find that as well. But they have different directories of which you can tap into to find or locate someone. Those are mostly individuals that are in private practice. And so if you are seeking someone that has a sliding fee scale within their practice, some of those individuals will have those and some will not, but it just depends. This is one resource, Brother, You're on My Mind, and it's an initiative that was launched by the Omega Psi Phi Fraternity Incorporated and the NIMHD to raise awareness on mental health challenges with depression and stress that affected Black men and families. So they offer a toolkit on their website that can be utilized during these times if you're a Black male. Then they have the Boris Lawrence Henson Foundation. They launched a COVID-19 virtual therapy support campaign. So that's another resource. And so individuals with life-changing stresses and anxiety related to coronavirus, will have a cost for up to 5 individual sessions defrayed on a first come, first served basis. So that is usually those are through grants. And so they are resources that can be accessed, and individuals typically don't know these resources are out here unless they reach out for those. So this is another outlet or resource that can be used, especially if you're seeking services and you may not have the resources due to being impacted on a number of ways. And so these are some resources that I wanted to share because individuals may not know that they are present. Here's another one, Black Men Heal. And so it's limited and selective, but it has opportunities for Black men. And so there are some resources for our men that are here as well as our females. And so these are Black mental health resources that can be utilized. And so the main thing is also taking care of yourself, continuing to take care of yourself. These are some resources that are here, especially with the times. They're tailored to what's happening currently within our society, and also just traumatic stress and grief in general. These are some resources. They have videos as well that can be viewed on your own time as well. So this is a great resource for individuals to read up on and kind of know more about mental health and some of the things on how to approach identifying services and information that would be beneficial. So I'm going to stop there and then open up the question and answer portion to see if anyone had any questions that they would like to ask. One of the questions is, if you are diagnosed with anxiety, can it be used against you in the workplace? Typically, I usually well, that's yes and no, depending upon what, where you work. Usually in military and police environments, there is stigma around reaching out and obtaining mental health treatment and mental health care because it can affect one's rank and one's position within the military, or which is why some individuals are not apt to seek services if they're in the military. But typically, in the hospital setting, that's something that is usually asked on questionnaires about if you've been Baker acted, if you're receiving treatment, if you're receiving care. And it's not in a way to ask to hold it against you, but to make sure you are, that your symptoms are under control and that it's being managed properly. But typically, if you are within the workplace, if you're diagnosed, have a diagnosis, then usually it is not used against you because it's confidential typically. But there are some professions where that information unfortunately can be used against someone.
Dr. Butler, this is Ayana. And I apologize if you've asked this question in previous seminars, but how do you know, because you went over so many resources, the question is, how do you know when you need to seek help from a mental health professional as opposed to a regular doctor, especially in cases where, you may be stressed and your body may be going through something. The first thing we do, like you said, is we'll go to a doctor, regular, I think you said physiology type, it's with our body. We think it's our body when the real issue might be mental health. And we know doctors always tell us stress. So is that when we go to the mental health? How would we know when is the best time to go seek mental health outside of like grief? Obviously, that's the easy one.
Right. So usually African Americans, we present with our symptoms like somatically, meaning that we'll have different aches and pains within our bodies. But usually if it is impacting your daily functioning, so if it's impacting your ability to work, your ability to socialize, just your ability to get out of bed, anything that's impacting your daily living and functioning, if you're irritable, if you're cranky, any of those symptoms that we presented over the last 2 seminars, those would be times that we can go in and actually seek care from someone.
Okay, thank you.
You're welcome.
Dr. Butler?
Yes.
Okay, this is Terry. I had a question that came through.
Okay.
It's a two-part question, and it says, with the holidays coming up, how can people with recent deaths cope? And then the second part of the question is, how can the people around them help them with coping?
So the first part is if individuals have experienced any type of loss, one of the good things is that they have, depending upon the severity of how and their and how they're coping, um, support groups are there. But with the age of COVID, those are happening virtually. There's some movement with cases going, practitioners going back to the offices, but they're still offering virtual delivery of services, or either just going through hospice and usually connecting with someone and processing through that grief, because if grief is left untreated, it can turn into depression. And so if you have not like attended like any support groups or found ways to cope, that would be the first part. That would be important to the healing process. And then the second part is it depends on the support system. Um, and I want to be mindful and sensitive of how I say this, because you can use family members as support systems if everyone is healthy, but at the same time, you don't want to overburden that individual as well, because they may be going through their healing process and their grieving process as well. So being able to seek your own support and your own treatment, and then also being able to be there without compromising your own mental health and wellness is important.
Okay, I have another question.
Okay.
Um, that question is, in your professional opinion, do you believe that medication is best, or if therapy is best for mental health disorders?
Well, it depends. There are times when individuals can go to, and this is, and well, let me back up. Both are effective, but it depends on the severity and different things like that. So going in and then receiving a um, official assessment, and what they'll do in an assessment, they will listen to whatever it is that's happening, and they will listen, get your story, get your feedback, get your symptoms of what you're feeling, how long you've been feeling them, when you feel them. So they will do a very in-depth assessment with you if you go to a mental health professional, because that's what they're trained to do. And then there are some times where they will offer therapy, and at a particular schedule, once a week, once every other week, depending upon the severity, and see how that works. Or there are times when symptoms may be so severe, or that after their assessment, they found that there's a severity, um, and that a referral to a psychiatrist is warranted. So that would be a question that would be best determined if someone goes into and see a mental health provider, so that they can thoroughly and properly assess them to find out what the need is. Because there are sometimes a practitioner will say, okay, well, therapy. And then there are times where we say, well, therapy would be beneficial, but we also want to refer you to the psychiatrist as well for an assessment.
Okay, thank you. Those are all the questions that I have.
Okay, thank you. Another question I received is, how can we destigmatize asking for therapy? Isn't it better to get a checkup to see if we are normal, but just need to do things that help us handle stress? So we can destigmatize asking for therapy by normalizing it. Not saying people are crazy, not saying people there's something wrong with someone, just because, or saying that you're weak, you need to pull out of it. And I know we are a group of spiritual individuals, but one of the other things is that when we have individuals that have varying, I'll say it this way, varying degrees of faith, typically we will say, oh, I'll pray for you, or just pray about it and it'll be okay. But there are times that I feel, even though I'm a person of faith as well, that there are individuals that may not know how just yet how to apply scripture to their lives the way some other individuals do. And so with that, you can still have faith, but then you can also learn how to challenge some negative cognitions that may be present. And so it's just normalizing it and not calling people crazy or saying there's something wrong with them, or ooh, they're going to see a psychiatrist or a psychologist or someone, and not ridiculing someone, which is something that we see or I have seen in the Black community with someone going to seek therapy or seek help. Just like we go and we get checkups for cancer and diabetes and hypertension and different things like that, our brain is an organ as well. And it functions and it functions and it helps us to, function everything else, work everything else in our bodies. And so when we are mentally, physically, emotionally, and spiritually well, we are operating at a higher octane than having only 3 or 2 of the domains operating. But no, it isn't better to check and see if we're normal, because normal can be relative. There are some individuals that are normal and they're okay, but their brain just works differently. And so when we get rid of that language to say, everything is quote unquote normal, but people deal with stress and handle stress in different ways. People's experiences that they have an impact on the way they interpret experiences down the line. Trauma is a great example. Interactions with friends can change the ways that we think about things. And so we have to make sure that if we're not feeling well, that we check in on that. If something is off, that we check in on that and say, I'm not well, or I'm not mentally well. We know that when we're not mentally well, we know when we're just like the prior presentations, when we're exhausted, when we're tired, when we're overwhelmed, when we're irritable. We don't have to do it all the time, everything all the time. And so taking a break and saying, I'm not well, I need support, I need help, is okay. Do Christians typically not seek therapy when they need it? Why or why not? There are some, we do have therapists that do specialize in faith-based or Christian-based counseling. And so that is an option to where someone can go in and seek a Christian or faith-based counselor if that's something that they would desire, if they would feel that would be more beneficial to them, if they feel like they would connect better with that person. So Christian counseling is something that is beneficial. I don't know what the research says on the rate at which Christians seek therapy or not, but I do know that they do offer, there are therapists that do specialize in Christian counseling or faith-based counseling. So that is an option as well.
Dr. Butler, another question came through. And
Okay.
it says, how do therapists separate someone that may have an imbalance in the brain?
How do we separate them? I'm not sure I'm following or understanding what's being asked.
Okay, hold on, let me see if I can get clarity.
I think Sister Nathan put in, how do they determine that there is an imbalance? Maybe, if that's what they're asking.
Okay. This person just responded. They said which licensed professional to seek out. So I guess I'm assuming there's an imbalance in the brain, and how do you determine which professional to seek out? Should you seek out someone, a therapist, or should you seek out someone else? I'm assuming. Let me just
Okay. So I'm
clarify.
going to answer it the best that I know how, and if it's off, just let me know. But when you go in to see a counselor or a psychologist, all of us are highly trained individuals, and so once they conduct that assessment, we have standards that we follow that will indicate if there is a potential disorder present or a disorder identified. We're highly trained to be able to diagnose and make that differentiation. And so if that is made, or there's if it's suspected that there is a presentation that will point to a potential mental health diagnosis, the individuals are trained to be able to do that. So a licensed social worker, a licensed marriage and family therapist, a licensed mental health counselor, um, a licensed clinical social worker are all qualified to do that. Also, psychiatrists are qualified to diagnose as well, but it just depends on after that assessment is completed, what they indicate would be the course of treatment.
Okay, thank you.
You're welcome. Are there any other questions? And so if there are concerns, it's just, they will, the mental health professional will conduct a thorough assessment and hear you out and listen to you, whatever that you present to them, um, and present you with information on how to proceed, and what recommendations for care or treatment are necessary. And so they're highly trained professionals that can assist you.
There are no other questions on the YouTube live nor in the Zoom chat. Uh, any comments on those that are on Zoom? Anyone want to unmute and make a statement or question? Okay, if not, I have one last question. I hope I framed this right, and I guess we can wrap up after that.
Okay.
For the kids, again, this is Ayana for those listening. For the kids that we started praying at the beginning of the pandemic, we're continuing to pray for the children that are having to deal with the virtual and also in person, the new wave, the new normal, the teachers, the staff, the parents, if they're having to work with the kids from home. And we really don't have a pulse exactly on how they're doing. We assume they're doing okay. And we know our youth minister Letitia Carter Dixon, she's been checking in with them. But what do you see as some of the long-term impacts? Because with the some kids are going to miss out. Some kids are not going to learn as efficiently as they did when everything was normal, our old normal. What are the long-term impacts, and what can the parents do to kind of circumvent that? Because even for kids who are going to school and having to have all of these major precautions, it's probably enough to frighten them too. so so if you could just kind of address, I don't have kids, but I care, and I'm just curious.
They are currently conducting research, and there's not enough data out there yet to identify what the long-term effects are going to be that I've seen or have had the opportunity to read. So they're starting to conduct studies. But one of the things is that the social isolation, the learning platform, and students being connected. I know with my observations with working with some of the students, is that they were frustrated with the learning platform. Some of them were having a difficult time following along. Some of them were missing out on their socialization with their peers. And so also having the virus looming, they were experiencing anxiety about how it would be to return back to school. And so just checking in on them to see if they're having changes in their mood, to make sure they're eating, making sure that they're getting that they're engaging. Also to just find out if there's been an increase in irritability, and if they don't want to be bothered, or if they're withdrawing. So those would be some of the things to look for. But the long-term effects, I don't think there is a lot of research that is present and that's there. And also monitoring their mood to see if there's any significant changes in their mood or subtle changes in their mood. And so the adults have to be more aware and more present and more engaged, especially during these times, because with children, we know that their friends and their social networks are important to them. And so, we've been children before, we've been teenagers before. And so I'm not saying that anyone is doing this, but just saying get over it, or you'll be fine, or different things like that. Acknowledge their feelings, acknowledge the fact that that is a loss for them is important, and to honor their feelings and to hold space for them if they need to come and talk. Because if one is overly critical, they're not going to talk, because it's already difficult to get a child to talk anyway and open up. But if they feel that their feelings are not going to be heard or appreciated, or the person is going to be receptive, then they could be in there plotting whatever and you won't know. So this is a time to be sensitive, to be in tune, and to be present, and to hold that space and honor their emotions and feelings, because they have them just like we do. And it's not healthy to have them to pretend that they don't exist.
That's good. Thank you. Thank
Mhm.
you.
Dr. Butler?
We'll be praying for that. Thank you.
Yeah, Dr. Butler.
Yeah.
As a result of this situation in education, with some kids on Connect and some kids face to face, the kids that are face to face have the advantage. The kids on Connect have the disadvantage, and they're frustrated. And like you say, they're going through all this, and this has never been handled before. Don't you think parents should, like you said, monitor and constantly communicate with the office and communicate the child's frustrations? And this is what I suggest. I mean, because I'm having to deal with this. You get faster results with an email than you do with a phone call.
Mm-hmm.
Emailing every teacher, the counselor, and even the principal if necessary. And because it's a paper trail. That's what I'm, you can expound on that, but that's what I'm having to deal with.
Usually I put the principals on correspondence if it's something that I need attention to, because individuals are more apt. I hate doing it, but it's unfortunate that it works out that way, but individuals are more apt to respond when they see their boss on the email. And so that puts them on notice that this is important. And usually they will work, but it just depends, because things are not as they were. And so teachers are a bit more overwhelmed than they already were. And so we just have to make sure that we're communicating, that we're being present, and that we're being persistent. Because that's one of the things, is that there's so much happening and so much going on that it's possible that things can be overlooked, but not on purpose, but things can be overlooked or go unanswered.
Excuse me, Dr. Butler, I'd like to add that, they say you can catch more flies with sugar than with salt. And even though I am aggressive at advocating for the children that I work with, I have an attitude of, I always keep a gracious attitude. I withhold, my emotions. I keep my emotions out of it. And I actually approach them as, I need your help. can you help? And I think, because it's aggravating when they don't follow through with what they're supposed to do. But if we keep our emotions in check and don't show emotions in our communication, but keep calm, we could get better results.
Mhm. Is there any other questions? Are there any other questions?
Well, Dr. Butler, I'd like to say that you've hit on all, really, it's been very interesting, all the points that you've made, and it's been very helpful, and you've done a fantastic job so far. I really
Thank
appreciate
you.
it.
All right, well, I am done, so I will turn this back over to the admins. So everyone have a wonderful evening and a wonderful rest of your week. And I think that'll be it.
Thank you.
You're welcome.
Praise the
Thank you,
Lord.
Dr. Butler. Pastor Wells, go ahead, please.
Yes, thank you, Dr. Butler. Just awesome information, awesome enlightenment, and so on point. We thank everyone who participated tonight, and I'm sure that you got some great information that can help in, we did in our everyday lives. And again, from the first time Dr. Butler and Sister Burke did the first seminar on mental health, working in the school system as well, I concur with Lady Nathan, and we have teachers also in our church, that it's very important that we do be even kinder to the students and more understanding to them, and what they get at home, they usually bring it to school. And so we have to really think of their mental health as well. So I thank God for all of the information. Thank God again, Dr. Butler, and just thank God that He's allowed you to be a part of us and in our midst. Praise God. And we pray the blessings of the Lord be upon you for taking the time to give us this information. And God bless you. If there's nothing else, just remember to pray for all of the saints, for all of those who requested prayer tonight. Please continue to keep them lifted up in prayer. And if that be all, thank you to our administrative team, to our tech team as well. And if there's nothing else, you may unmute and fellowship, and may you have a wonderful rest of the night. Love you all.